Hello, my name is Hollingworth-Hughes and I'm an accredited exercise physiologist. It's my honour today to be giving a brief presentation on the role and benefits of exercise in the general management of spinal cord injuries, incorporating paraplegia, tetraplegia and all classifications of the Asia Impairment Scale. As an AEP, I am passionate in providing best practice to clients, implementing client-centric and evidence-based interventions. This presentation will explore the relationship SCIs has with exercise, covering expected effects and barriers, the benefits of exercise proposed by evidence-based literature, likely adversity faced due to the complex nature of SCIs, with how to monitor these responses, ensuring client safety, and finally we'll discuss the general guidelines for exercise prescription. So, the focus of exercise for spinal cord injury populations. As you can see in the diagram, from a prospective study on physical activity levels after spinal cord injury, SCI patients perform relatively low levels of PA compared to persons with other chronic diseases. This profound sedentary behavior is said to compound the adverse effects of spinal cord injury, negatively influencing health, fitness, and function. Promoting physical activity and reducing sedentary time in SCI populations has, however, been shown to reduce the prevalence of comorbidities and mortality rates. Participation in exercise can be difficult due to the effects of SCIs and the associated barriers formed under three main headings proposed by Selzer and colleagues in 2005, including intrinsic barriers, resource barriers, and structural or architectural barriers, such as lack of motivation, poor knowledge, accessibility, and financial pressure. However, identification of these barriers to exercise can help mitigate these obstacles, while facilitating exercise participation and early intervention adherence, which can help improve health outcomes. Evans and colleagues in 2015 suggested promoting activity and exercise is essential for health and quality of life for people living with spinal cord injuries. Tweedy and others in 2017 indicated there is strong, consistent evidence regarding exercise improving cardiorespiratory fitness and muscular strength in people with SCIs. Moreover, there is developing evidence surrounding exercise and its benefits, including but not limited to reducing the risk of cardiometabolic diseases, promoting quality of life, and increasing functional independence. A 2003 randomized controlled trial by Hicks and cohort also demonstrated exercise significantly reduced pain, stress, and depression, the prevalence of which are all markedly higher in SCI populations. Due to the effects of SCIs, facing adversity is highly probable during exercise, and abnormal physiological responses may occur. Close monitoring of a client's signs and symptoms, accompanied by action prevention strategies, can help ensure client safety, such as in the case of autonomic dysplasia, fracture risk, and post-exercise hypertension, as laid out in the table, among others. For example, autonomic dysplasia may occur during a session, to which blood pressure may be taken for measurement and assessment, after possible physical signs are observed by an AEP or noted by the client, such as discomfort, headaches, or sweating. An AEP action to this scenario would be to stop and assess the cause of the problem before deciding to cease or continue exercise after appropriate management has taken place. The literature is fairly consistent regarding exercise prescription for SCI populations. In fact, guidelines for SCI populations published by Tweedy and colleagues in 2017 for Exercise and Sports Science Australia, indicated in the table, suggest aerobic and strength exercise guidelines aren't too dissimilar to those suggested to the general population. Promoting 3 to 5 days of moderate to vigorous aerobic activity, accompanied by dynamic and static flexibility training, plus strength training with a focus on major musculature with added emphasis regarding shoulder and scapular stability. Further guidelines regarding exercise modality, frequency, intensity, time, and type can be seen in the table. In summary, it has been established safe participation in exercise is achievable for SCI populations, enabling many health benefits including management and prevention of comorbidities, improving functional capacity, and promoting quality of life. This can be aided by early identification of barriers faced by SCI populations, facilitating participation in exercise programs. When working with SCI populations, it is important to note potential physiological responses to exercise and implementing strategies to overcome these adversities. Ensuring early education regarding the benefits of exercise is essential in promoting self-efficacy for positive lifelong exercise adherence. I hope you have found this presentation informative. If you have any questions regarding the content, please don't hesitate to contact. Thank you for listening.